So my presentation, in fact, is really informational, and I'm really laying some groundwork for my colleague, PJ Gorence, who will be presenting tomorrow. But you need to understand, I guess, where we've come from to understand where we're going. So that's pretty much what I'm going to talk about. Yes, I'm Gina Altieri, Senior VP of Corporate Services at the Nemours Children's Health System. And corporate services includes information security, information systems, marketing and communications, project management, continuous improvement, and the Center for Health Delivery Innovation that I will explain. And it includes the estate, and I'll explain that as well. So a little bit about Nemours. Nemours is a children's health system. We employ our physicians. There's over 800 of them. We practice in Delaware, Florida, New Jersey, Pennsylvania, and Maryland. The pictures that you see, the one on the bottom is our children's hospital in Orlando, Florida, and the one at the top is our children's hospital in Wilmington, Delaware. The hospital in Wilmington, Delaware shares 300 acres with the estate of our founder. So we exist because of a transformational gift from Alfred I. DuPont. And it was his belief that it is the duty of everyone to do what is within his power to alleviate human suffering. And so his will dictates that after you take care of his estate, you actually can help, at the time, the term was crippled children. And to know that what we started back then to where we are now is truly remarkable. We've been fortunate that our CEO has also been a very transformational leader. And Dr. David Bally has been with Nemours for around 22 years. Actually, I've been there with him the whole time. And he always brings us back to the child so that everything that we do is focused on the child. And it is he who coined our Nemours True North. Help me receive exactly the care I need and want, when and how I need and want it. When that was first stated from a strategic perspective, it clearly is very visionary, something that we probably could never achieve. But I can tell you, when a lot of the providers heard that statement, they thought that that was actually wrong, that we should not be appealing to what people want, but that we should be doing, what the provider says that they need. So it's been an interesting ride. He's been CEO for the past 13 years, and he is retiring this year. So this is a picture of my daughter. And when she was little, the one on the far right, she was a runner, and that's her 4x400 relay team. And they went to nationals every year. And the reason I included the picture is because they represent our millennial population. They're 27, 28 now. And the one on the end is a mother. The blonde is a nurse. My daughter's in the middle, and I'll get to her. And then the one on the right decided to stick with it, and she actually put a lot of hard work into running and made it to the Olympics. So I include that because it relates to me and Nemours in that we've been at it a long time as well, and by it I mean IT. And I'll describe our journey in information technology at Nemours and how this has been a very long process to get us where we are today in order for PJ and his team to do what they do. It's not something that you can say within a year we can accomplish something. We've been building this for over 20 years. And then my daughter is on the right. She's a prosecutor in Camden, New Jersey. And Camden, New Jersey has the third highest crime rate in the nation. And she's in juvenile. And, when I see her occasionally, she will share some stories. And one that really hit me was a child, 14 years old, actually had his mother's boyfriend killed and arranged it all on Facebook. So clearly, We find, share, and consume information much differently than we used to. And I say that because of the impact that this millennial generation is having on a variety of industries, including healthcare. So back to our IT journey. Not that the specific points are, that important for you to know, but where we are now is that we do have a single platform EMR, so that wherever a child is seen in our health system, whether it is in their pediatrician's office, an urgent care center, an ambulatory surgery center, inpatient hospital, or emergency room, it is the same record. And that family has access to that record. And that's very important, as Dr. Sullivan was explaining, so that information, that data is available to them. That has allowed us to deliver remote monitoring, and I'll show you what we do in that regard, as well as, like I said, the healthcare delivery innovation. I shudder to use the word, but the way that we are conducting our innovation efforts, this was necessary to build that foundation. So this is what it looked like when I first got there. We had a bunch of computers on the shelves. We had paper charts, and we had our data center wasn't very neat and tidy, if you will. It's unfortunate, but that is how a lot of health systems or private practice offices look like today. And we've had to, like I said, really work very hard in order to build the foundation to get us where we needed to go. And we've been fortunate that our CEO has supported this along the way, knowing that this was a very long-term vision to get us where we needed to be. And we use this technology to enable better care and improve health outcomes. And another important factor is the fact that we've been on this EMR for so long, 25 years or so, we do have a wealth of data, and the data extends for the life of a child. And as you were suggesting, if we could partner with a healthcare adult system to really look at the data for the lifetime of the human being, I think that there would be some value in that, and I don't necessarily mean financial value. So how do we deploy some of the technologies? We do provide data to the clinicians. Some of it they can access themselves very easily. Some of it they have to have the help of some IT professionals. But they do have information available to them via dashboards. And we also have the largest integrated radiology department in pediatrics in the country. And so all of our radiologists, no matter what location they are based at, again, they're on a single PACS system, and they share the reading responsibility so that, first come, first read. They're not just reading for their particular site. And, only a technology can enable that kind of care. To the extent that their turnaround time is now the best in the nation. It's a 13-minute turnaround time. And that has a big impact on access to care while you're waiting in that emergency room. We have a lot of technology surrounding the bedside. The picture on the right is actually our remote monitoring, where we can go into the room, if need be, and see what's happening, literally see what's happening in the bed. They're usually remote monitoring and looking at data and screens. And of course, there's an entertainment component as well as an education component. So this is the remote monitoring center. This exists in our Orlando facility, but it monitors all the beds of the health system. And we intend to start monitoring some beds at our partner organizations as well. It is the first in the world in pediatrics, and it has saved lives. We've had, there's cameras in every room, and they notify the family if, in fact, they're coming into the room because they see something happening on the screen. So now I'm going to flip it a little bit to, that millennial consumer, and what's that mean? to healthcare. So I think you would all agree that Amazon did not kill the retail industry. The retail industry did it to themselves. They did it to themselves because of bad customer service. Netflix did not kill Blockbuster. Blockbuster did it to themselves with those exorbitant late fees. I can go on and on, Uber and the taxis and access to a taxi. But the point is, technology itself is not the disruptor. When we do not appeal to the consumer and meet their expectations, that's the biggest threat to, in a sense, a business. So we've taken that very seriously with our Center for Health Delivery Innovation, and we really looked into who is the Nemours consumer. And we used our own focus group information. We conducted our own surveys on our website, Kids Health. And we also used the research from others. So this is from the advisory board. They interviewed over 1,000 or so healthcare users to ask them about their expectations. And as you can see, in the millennial generation, they're ready for technology. They're ready for a telehealth visit. In fact, if it's convenient, they're all about it. They're not very loyal to the primary care physician, as many older people are, right? So, and I consider myself one of those older people. So, when a primary care physician used to refer us out, we would do what they said. And in fact, I've heard my parents say many times, well, what would you do, doctor, if this was your family? The younger generation doesn't say that. They say, give me the information, I will make those decisions. I will research the information. They want that information, and right now they're getting it on social media and sharing it on social media. So our millennial parent, the decision maker, is our ultimate consumer. And what they have said to us, basically the tech-savvy ones, and PJ will go into this more, about 80% of them said the digital experience in healthcare really needs improvement. And to them, we need transparency. They want to research what is best for them, whether that's cost, outcomes, or some other factor that they're interested in. They want it, most importantly, to be fast and easy, or they're just going to go somewhere else. So our response to that has been Nemours anytime, anywhere. And our aim is to expand a more accessible continuum of care. Access is very important, especially after hours access. Within our communities, in order to be a more proactive partner in guiding and empowering parents throughout their children's development. So what we would like to become is actually that health coach, if you will, that ubiquitous voice that helps the parent every step of the way and meets them where they are. So how are we doing that? So we formed the Center for Health Delivery Innovation, and we've taken our unique ecosystem of digital assets. Like I said, we have our Kids Health website, which is content, information for parents, teens, and children. That has been in existence for over 20-something years and has about 1 million visits a day. We want to take that large funnel of people seeking information and then direct them to either a Care Connect visit, which I'll explain, or go to a Nemours site. I'll also explain some of the other digital assets. The graphical display shows that this Center for Health Delivery Innovation, what is unique about it is the technology team, the Nemours Consumer Digital Health team, works very, very closely with patients and families using design services, as well as agile methodology, to work with the clinicians so that it is a win-win for everyone. I think PJ is going to explain some of that tomorrow. We also believe at Nemours that literacy is the #1 indicator of adult health. And so it's very important for us that we help parents help children read. And so we're out in the community, we're out in daycare centers, we are out in Head Start programs. What we're trying to do is turn that also into a digital experience so the consumer can reach it directly. And we have a website, but we're just not getting that traffic, and rather than compete with ourselves, we're going to embed that not only in an app, but for now, in our Kids Health website. We also created a consumer insights group so that we can actually track what the consumer is doing online and what their needs are. So starting with information that they're seeking, and like I said, how do we move them to a call to action? We offer online appointments, which is somewhat unique. Most health systems are offering a request for an appointment, not necessarily an actual online appointment. And like I said, we're also directing them to our physical locations. We have a patient portal, and it has been pretty clunky, but families can seek some functionality with some of the other functionality that exists in the digital assets. PJ's team has done a wonderful job of making this fast and easy so that they can actually use it. This is our Nemours telemedicine program, and it's called Care Connect. It's a comprehensive telehealth program in that we use telehealth a variety of ways. We have clinician to partner facility. So if there's a community hospital that might have a very sick child, they will press one button because our carts are in the emergency room or the critical care units and access a pediatric specialist to help guide the care of the patient or to help determine together that that patient needs to be transferred. We also have specialty care telehealth visits from, let's say you go to your pediatrician's office, which is close to your home, but the hospital is several hours away. You can actually have a specialty visit at your pediatrician's office. We also have direct-to-consumer, which is 24/7, right from your home. And we're in schools. We provide access to the medical record to the school nurse. We provide telehealth visits, and we are on cruise ships, Disney cruise ships. And so basically, this is the 5 digital assets that we're pulling together to make one unified experience, so families don't have to go to different places for that Nemours virtual experience. And PJ will be explaining that tomorrow at some length.